Welcome back. On the 7th of November, the 15th meeting of the National HIV Multi-Sector Leadership Forum took place under the theme Sustaining Effective Leadership to Secure Gains, Bridge Disparities and Expedite Progress in HIV Prevention Efforts. Representing the Ministry of Health and moderator of the forum was the Executive Director, Ben Nangombe, from the Ministry of Health and Social Services. He now joins us on the line to provide some insight and feedback. Mr. Nangombe, good evening. Thank you so much for joining us.
Yeah, good evening, Nina. How are you this evening?
I'm good, sir. Thank you so much for joining us this evening.
Yes.
Just to begin with, Mr. Nangombe, talk to us about what the primary objectives of this meeting was.
I think the meeting was really convened in order to bring together the leaders or the directors general of the national AIDS coordinating authorities in various countries to bring them together in order to basically build on the momentum of the previous meetings that were held in order to address the HIV pandemic more aggressively and more concretely. And this is because it has been seen that despite the successes that have been recorded in many countries in bringing AIDS to an end as a public health threat, there are still new infections taking place. For example, in 2022, there were 1.3 million new HIV infections around the world, which are way off target from the target of 2025, where we were envisaging infections rates or new infections of HIV of lower than 370,000. So this meeting was convened in order to ensure that more momentum is built around the question of ending HIV/AIDS as a public health threat.
Talk to us about what the primary contributing factors are to these new infections, Mr. Nangombe.
The new infections can be attributed to a number of factors. In a country like Namibia, for example, you have this question of intergenerational sex, where you have sexual intercourse taking place between young people and those that are older than them. You have the question of particularly adolescent boys and young men who seem not to grasp the message about the importance of protecting themselves and engaging in protective sex. So that those are some of the factors that are leading to new infections. It's also, it can be attributed to some complacency among people who may already be infected, not taking the necessary care to protect themselves, and also related to the question of key populations who may feel marginalized when it comes to these services and therefore may not be accessing HIV services as they ought to do in order to prevent new infection.
Notwithstanding what you said concerning the concern around new infections, Mr. Nangombe, Namibia has made great strides in its fight against HIV. So what strategies have you found to be the most effective in bridging disparities and promoting progress in HIV prevention and treatment?
Yeah, indeed, Namibia has done quite well. We have been recognized internationally in terms of where we stand on the targets for the HIV/AIDS cascade of the 95-95-95, where we are basically saying that currently Namibia stands at, I think, 97, 94, 93, if I'm not mistaken, meaning that the number of we now know that 97% of people who are HIV positive in Namibia know their status. 94% of those who know their status are initiated on treatment, and 93% of those who know their status are virally suppressed. And we have achieved this through a combination of factors. This includes, for example, the strategy that we have put in place for those that need the services to access them at different levels of health care. We have put in place, for example, the Pele boxes, where those that are initiated on treatment can actually access their medications and other chronic medications through these boxes that look like almost post offices, post office boxes. They are installed at various health facilities. So far, we have installed about 17 around the country, and the patients or people who are on HIV medication and other chronic illnesses can access these medicines. We have also put in place strategies that allow for people who are HIV positive to be encouraged to adhere to treatment. We have the teen adherence clubs. We have other clubs for or institutions for people with HIV/AIDS who are living with HIV/AIDS, being encouraged to remain on treatment, to adhere to the treatment so that they remain virally suppressed. And we are saying that viral suppression is important, because if you are virally suppressed, it means then that even if you engage in unprotected sex, you are not able to transmit the infection to your partner, because we have this saying that U equals U, meaning that undetectable equals untransmissible. So these are some of the interventions that Namibia has put in place. We have been recognized for that. We have even received international recognition through PEPFAR when we went to Johannesburg in February, where we were given this award recognizing our achievement in terms of moving towards total epidemic control and ending AIDS as a public health threat by 2030. In fact, we have even gone forward and set ourselves more ambitious targets on the HIV/AIDS cascade of 95, 95, 95, where we are saying Namibia wishes to reach 97, 97, 97 by the year 2028. So that is where we are, and those are some of the strategies that allow us to get where we are. Of course, we are not doing this alone. We have very supportive development cooperation partners who are supporting us in this effort.
On that note, Mr. Nangombe, what role do you see for multi-sector partnerships in advancing the HIV response, and how can we ensure that these partnerships are equitable and effective?
Yeah, indeed. As I said, we are not doing this alone. We have very committed development cooperation partners, whether from other governments, such as the government of the United States of America, whether it is from the Global Fund, whether it's from the WHO, whether it is from the non-governmental organizations from Namibia and elsewhere. And this is, for example, evidenced by the strong financial support that we are getting from some of these development cooperation partners. And these are enabling us and are facilitating our goal and our march towards ending AIDS as a public health threat. So what we want to achieve is really to get to a state where we have zero infections, zero AIDS-related deaths in our country.
Talk to us, Mr. Nangombe, about how the ministry prioritizes competing demands and allocates resources in the context of limited funding and resources for HIV programs.
I think it has to be noted that when it comes to funding for healthcare services in Namibia, looking at the total health expenditure in the country, the government of Namibia carries the largest chunk. And when it comes to the funding also for HIV/AIDS interventions, the government is funding up to 60% of the interventions that are being implemented in the country. But of course, this is going hand in hand with making sure that other services, other healthcare services in the public health sphere are not neglected. You will know that more than 85% of Namibians actually depend on the public health sector. And that means we have to play a balancing act. It's a fine line of allocating resources to programs such as interventions for HIV/AIDS, but again also looking at making sure that the primary healthcare approach is adopted in order to enable our people to receive the services that they need. We are in the process of developing the universal health coverage policy framework that is going to ensure that Namibians are able to receive the services without having to suffer financial hardship. So other activities that we are looking at, for example, include the rollout of the human papillomavirus vaccine to protect our young people, particularly the young girls, against cervical cancer, which is a conduit also for HIV infections. So some of these programs are being implemented. We believe that we are on the right trajectory, and the prioritization must continue. Again, we take account of the fact that the interventions that we are implementing require adequate human resources. So the training of human resources is important, whether in service training or qualifying training, so that we have the sufficient human resources to be able to carry out the activities that are required.
Mr. Nangombe, the position paper of the HIV Forum was also launched at the 15th meeting. Can you tell us what that entails?
Yeah, the position paper basically looks at what was discussed during the conference. And it is articulating the vision going forward so that the leadership role of the national AIDS coordinating authorities in the future of HIV prevention remains sustainable, so that we are able to prevent future pandemics. And this is an important document that is going to guide us in the HIV/AIDS pandemic intervention going forward, both nationally and at the global level.
Before I let you go, sir, your final remarks this evening?
No, I just want to say that despite the challenges that we face, I think Namibia as a country has done very well. We are a role model for many other countries around the world. We, for example, have been receiving visitors coming to Namibia to learn from our experiences. We recently launched the social contracting policy that is going to have an impact on the way we deliver HIV services to communities. And going forward, we are going to maintain the momentum that we have developed so that we are able to end AIDS as a public health threat by 2030. And as I indicated before, by 2028, we want to achieve already on the cascade the percentage of 97, 97.
Mr. Nangombe, it's always a pleasure having you with us. Thank you so much for your time, and thank you for speaking to us.
Thank you very much.
That was the Executive Director in the Ministry of Health on the line. Mr. Ben Nangombe is speaking to us. We'll be right back shortly. Stay with us.